Hey guys, welcome to my YouTube channel. So today we'll be talking about infertility. This is a major problem around the world. Sometimes it seems like you're the only couple in the universe struggling with fertility issues. It can be disheartening watching your friends, co-workers and family members announce pregnancies, show off gender reveals and baby shower. My advice is don't ever give up. No matter how frustrating it is, please don't give up. Keep your faith strong, be positive, and things will fall in place just in time. For many couples, the stress and challenges of trying to conceive puts a strain on the relationship. Like that is not enough. Family interference here and there just worsens the issue. So now, let's have a picture of what infertility is all about. Infertility means not being able to get pregnant at least after 12 months of unprotected sexual intercourse without birth control. Women who can get pregnant but are unable to stay pregnant may also be infertile. To get pregnant, a woman has to ovulate. This is the release of an egg from our ovaries. The egg also goes through a fallopian tube towards the womb. Afterwards, the man's sperm must fertilize the egg. The fertilized egg must be attached to the uterus. This process is called implantation. Infertility can happen if there's a problem with any of this. Infertility is divided into two types. We have the primary infertility and secondary infertility. The primary infertility is when you're unable to conceive your first child, while the secondary infertility is when you're struggling to conceive after your first child. 15% of couples struggle with infertility. About 1/3 of infertility cases are caused by women, while another 1/3 of infertility are also caused by men. The other cases are caused by a mixture of male and female problems or by unknown problems. For example, both parties being medically fit and still not able to conceive. Now that we know that a man can also be infertile, let's check out what causes infertility in men. Low sperm count. This is when a man produces few sperm or none at all. Abnormal sperm. This may be caused by the shape of the sperm. This makes it difficult to move and fertilize the egg. They are both caused by a term called varicocele. This is when the veins on a man's testicles are too large. This eats up the testicles and can affect the number or shape of the sperm. Other causes are low sperm motility. This is when the sperm can't move well and makes it difficult to reach the egg. And we also have injuries or other damages to the reproductive system, which can block the sperm. Sometimes a man can be born with the problems that affect his sperm. And also, the problems might start later in life due to illness or injury. There are some factors that increases the chances of infertility in men, and they include heavy alcohol use, drugs, smoking of cigarettes, age, environmental toxins such as pesticides and lead, medicines, health problems such as mumps, kidney diseases, hormone problems, radiation treatments, and chemotherapy for cancer, to mention a few. Most cases of female infertility are caused by problems associated with ovulation. Without ovulation, no egg can be fertilized. Irregular or absent menstrual period are signs that a woman is not ovulating normally. Ovulation problems are often caused by polycystic ovarian syndrome. This is a hormone imbalance problem which can interfere with normal ovulation. It is the most common cause of female infertility. We also have primary ovarian insufficiency. This occurs when a woman's ovaries stop working normally before she's 40 years. Note, it is not the same as menopause. Other less common causes of fertility in women include blocked fallopian tube due to inflammatory diseases, endometriosis, and the likes. Physical problems with the uterus. Uterine fibroid, which are not cancerous clumps of tissues and muscles on the walls of the uterus. Now we're going to look at some factors that can change a woman's ability to conceive. Age. This is the growing cause of fertility problems, which comes with some disadvantages. First of all, A woman's ovary releases less eggs. She has few numbers of eggs left. Her eggs are not as healthy as when she was younger. She is more likely to have health conditions that can cause fertility problems, and she's more likely to have a miscarriage. Other factors include smoking, excess alcohol use, stress, poor diet, athletic training, being overweight or underweight, sexually transmitted infection, and all health problems that can cause hormonal changes, to mention a few. Note, guys, whatever information you get here is based on research. Always visit your doctor and get the right medical advice and prescription. So let's digress a little. Infertility has been a very challenging problem in the world and is a global health issue. Infertility or childlessness is a major problem which can cause marital instability. Baby making is supposed to be a beautiful time in a woman's life, obviously. It is full of emotional closeness, gleeful anticipation, and a lot of bonding between the mother and the child. It takes two to have a baby, but what baffles me is why do many people always direct infertility to a woman? There's a considerable awareness of female fertility, and if a couple is having difficulties in conceiving, the natural conclusion is to have the woman seek treatment. Like I said earlier, both women and men can have problems that causes infertility. It is not always a woman's problem. Okay, please, we really need to get that. This is not always a woman's problem. Where I come from in Africa, women are mostly the first to be blamed if couples are unable to have children. Children are associated with happiness and viewed as a form of intergenerational social security. Right from childhood, a woman is culturally raised to accept responsibility for reproduction and infertility. Most times, another major problem is the family, especially the husband's family. They begin to give the wife unnecessary pressure. The mother-in-law constantly reminds her of how eager she wants to carry a grandchild. As years goes by without a child, the wife loses a respect in the family. Derogatory words are said to her, and sometimes threat of getting another wife for the husband keeps flying in the air. This period is really depressing for the woman, no matter how supportive her husband is. Sometimes the husband begins to listen to advice from friends and families, and due to that, that's giving the wife unnecessary attitude. Some even send their wives packing because they believe they can't fulfill their right as a woman. Living as an infertile person is very distressing, particularly for women. This is due to the stigma in the society. It is associated with mental health issues such as depression, suicidal ideation, insults, lack of sexual desires, and sometimes even divorce. If you're around someone who is struggling to conceive, there are things you should say and things you should not say. You never can know what might trigger them. You should always let them lead the conversation. Always reassure them that it's a common problem and they are not alone. Tell them you're sorry when you need to. Assure them the phase is temporary and they're going to be fine in no time. Give them examples of someone in their shoes, but due to perseverance, good medical advice and treatment, have their own children now. Even if you don't have one, just cook up some story. Don't worry, you're not lying. God would understand. What I'm trying to say in essence is they need reassurance from time to time. They need something to make them happy, to calm them down, and also reignite their hope. And please do endeavor to check on them from time to time. Things you should avoid saying is asking them when they would have a child, what the society thinks of them, what their partner does behind their back. Some friends are just bad vibes. They just mess up your mind with awful things. You should avoid telling them to try so many alternatives at the same time. You should also avoid telling them to double up their sex game. All of these are so depressing. You're not helping them at all. You're just adding more to their problems. There are some mistakes people with infertility make. Self-blame. You might be thinking you waited too long to start a family. Maybe you shouldn't have chased the money or the career as at that time. Maybe something foolish you did some time ago messed up your fertility. Or perhaps you have no idea what could have possibly led to your current problem, but you are sure it is something you could have stopped if you had known better. you really need to stop blaming yourself. Even if you could find a way to make it your fault, you still need to stop blaming yourself. It does more harm than good, trust me. Praying for a miracle. It is very good to pray and have a strong faith. However, it is very important you visit your doctor at the early stage. There are some causes of infertility that worsen with time. While you pray for your miracle, your chances may be quickly disappearing. So it is advisable you visit the doctor for necessary treatment while you pray and stay positive. You should also avoid friends that make you sad anytime you're with them, be it their words or action. There are some friends that uses their child or their child's achievement to spite you indirectly. They might not intend to make you feel bad, while some do it on purpose. Lastly, do whatever makes you happy. Try and get busy so you wouldn't think about it so much. So that's it, guys. I'll talk more on fertility tests and treatment in my next video. Please don't forget to subscribe, like, and drop a comment below. Bye.